Yeah, so for the next discussion we'll be talking about what is drug allergy. Alright, so this is actually one of the syllables for students in usually Ukraine, Hungary, and the rest of it. So, drug allergy. So, they talk about drug allergy in the Western world a lot because white people, they actually respond adversely to drug more than Africans, So, drug allergy, you should just know that you took a drug and your immune system didn't like the drug. So, your immune system is responding adversely to the drug. Okay, so one of the modern ways of actually avoiding this drug allergy is, first of all, from your history taking, you ask the patients if they have ever had any reaction to any drug before. So if they have ever had any reaction to any drug before, even if it is not that drug you want to give them, you always inquire to know, because you shouldn't give any drug that is related to that drug to them. You understand? So drug allergy, you should know that it's an abnormal reaction of your immune system to a drug that they give you. So your immune system, instead of welcoming that drug as like soldiers you sent to rescue the body, the immune system is thinking those drugs are ops. Ops in UK music, ops, I'll shoot my ops, So it's like harmful substance, okay? So it's actually different from the common side effect that a drug will have. Like, say, when you take a drug, you feel like you want to vomit, you feel like headache. Those ones are not allergies. Do you understand? Allergies, you see a physical reaction. Your body is literally burning off a whole lot of things. If it's in your stomach, the intestines are getting inflamed. Allergy is almost an emergency. Okay. So your immune system reacts to the drug and it produces antibodies, okay, and release a lot of histamines, okay, which can cause allergic symptoms. In allergies, you can also feel like you want to vomit. Not feel like you want to vomit, you vomit, and you vomit heavy. Like, everything that has to do with allergy is always adverse. Do you understand? Why the side effects is kind of like user friendly, you understand? So timing, it can appear quickly or it can be delayed. Okay, severity, allergies could be mild to severe to even life-threatening. So common symptoms in allergies, usually the symptoms on your skin. I have all the pictures here, so you're having all those raised itchy welts, your skin is becoming red, is becoming bumpy, there's severe fever, there's swellings in different parts of your body. Some people see swelling around their eye, swelling on their mouth. Some people see their mouth very big. Okay, it's different, right? Then watery eyes, your nose is running and itchy. You understand? So anaphylaxis is a life-threatening reaction. So anaphylaxis is the most severe form of drug allergy. Do you understand? That one is a medical emergency. So if you say drug allergy, it's something that you can just manage the patient. But when you are saying anaphylaxis, bro, everybody in the hospital is supposed to be activated. Okay, so there's tightening of the airways and throat. So the person has severe issues trying to breathe in anaphylaxis. There's nausea, heavy vomiting, dizziness, fainting, loss of consciousness. Alright, and the person is generally weak. So common drugs that usually cause allergies, we're not covering all, it's just examples. So antibiotics like amoxicillin, pain relievers like aspirin, non-steroidal anti-inflammatory drugs like ibuprofen, okay, sulfur drugs, okay, chemotherapy drugs, those drugs they use in treating cancers. Their effects usually so heavy on the patient that sometimes if a patient has cancer, it's not even the cancer that kills the patient, it's the drug therapy. Okay, most people that die from cancer is the drug therapy. Or if somebody who died from cancer, most of the times is because the cancer has moved from its primary sites, has spread to the lungs, so they have complication with breathing. You understand? There's sometimes medicines for autoimmune disease. So when your immune system is destroying the cells of the body, you give what? Immunosuppressants. Those are drugs that basically calm the immune system down. So those ones too, their issues could be so heavy. So treatment, they have to actually diagnose you by asking you a lot of questions about the drugs you previously took. Okay, then they can do skin tests, blood test. So treatment is they have to withdraw the drug they are giving you. Then they treat you symptomatically. So if you're having difficulties in breathing, they put you under oxygen. A lot of things, bed rest, a lot of things. But most importantly, you have to stop the drug that is actually causing